So, in the previous video, we talked about health communication. What is health communication, the importances of health communication, and all that good stuffs. In this particular video, we are going to learn about the various methods and medias of health communication. Basically, what are the various approaches for you to impart health education? What are the ways you can communicate? What are the various approaches? And there are three approaches that you need to know in detail: individual approach, group approach, and mass approach. Again, individual approach, group approach, and mass approach. In individual approach, there is individuality. There is one individual talking with another individual face to face, and they communicate directly with one another. That is why you also call it face to face communication or interpersonal communication. Since one person or one individual is talking directly with another individual, there is maximum opportunity of two-way flow of ideas and information. There is maximum opportunity for two-way flow of ideas, knowledge, and information. Individual approach includes interview, counseling, home visits, and personal letters. Second is group approach. In group approach, there is a group of audience that is being targeted by a single or multiple communicators or multiple senders. So there's a group of limited persons who have same kind of health problem. In examples are lectures, demonstrations, group discussion, panel discussion, symposium, workshop, conference, seminars, role play. Then there's finally mass approach. In mass approach, there is a large group of audience being targeted at once, usually with the help of mass media. Not usually, you need a mass media to target a large audience anyway. For example, there might be one person at one corner of the country watching a serial in TV, another person at another corner of the TV watching this corner of the country watching the same serial in the TV, another person at another corner watching the same serial in the TV. So there are a large number of people watching the same serial at different corners of the country in television. So here television is mass media, and with the help of mass media, a large number of people or a huge audience is being targeted at once. Okay, so large number of people. Since there is large number of people, obviously there's going to be variety in them as well. And then there is use of mass media. Since there is use of mass media, it is one way communication. The people, they can look, observe mass media, listen to it, look at it, but then they can't talk back. These are the various mass medias that can be used for mass approach of communication. So in group approach, there was less variety, because in a group we had people with similar health problem. In mass approach, there's a huge variety of individuals, whether they have health problem or they don't have health problem. Okay, so there was individual approach, one person talking with another person. Group approach, a group of audience being targeted by one or more senders or communicators. And mass approach, a large number of audience which is targeted at once with the help of mass media. First, let's look at individual approach. In individual approach, as I said, there are two individuals that talk with one another. So it is face to face or person to person communication. Since one person directly talks with another person, there is maximum opportunity of exchange of ideas between the two people. It includes interview, counseling, home visits, and personal letters. First, interview. In interview, there is one interviewer and another interviewee. The interviewer asks questions and the interviewee gives answers to those questions. Then there's counseling. In counseling, there is one person who tries to find out and solve the problem of another person. It can either be patient counseling, where there is your doctor. The doctor tries to find the problem of the patient and solve the problem of the patient, or it could be behavioral counseling. For example, there's a teacher who is trying to counsel his or her student about education and his behavior, trying to bring a positive change in his or her attitude. Then there's home visits. Maybe a patient is bedridden, he can't leave his home, so the doctor directly approaches him in his home to check him up. That's home visit. Or it could be personal letter, where there is a letter with blood test written or a letter about health status written. So all of these are individual approaches. In interview, there is Q&A taking place, question and answers between health educator and learner. In counseling, one person helps another person find and cure his problem. In home visit, here healthcare provider travels to patient's home for follow-ups. In personal letters, there's a letter from healthcare provider to patient. Okay, so these were all individual approaches. Interview and counseling will have a video of its own because these two topics need to be understood in much more detail. Next, we have group approach where a group of audience is targeted at once. For example, lecture. In lecture, there is one qualified person that is talking about a certain health subject to an audience of individuals with individuals less than 30 people. So again, the lecture can be on diabetes, the lecturer talk about diabetes and the audience listen his lecture. That's it. It is also called chalk and talk method. Group size should be less than 30 individuals. Means the audience should contain less than 30 individuals. And then the duration of the lecture can be 15 to 20 minutes, but not more. What are the advantages? The advantage is that a large number of people is being targeted at once in a small time frame of only 15 to 20 minutes. Only one qualified person is needed and he has enough time to talk about different information, different stuff that he knows about. It is very economical. All you require is a board and something to write on the board. Disadvantage is that the audience doesn't get the opportunity to ask questions. Since the audience does not get the opportunity to ask question, there is no active participation. Unlike your typical lectures that take place in classroom and colleges where you do get opportunity to ask questions, an appropriate lecture is where 15 to 20 minutes of lecture time is there and there is no question and answer session between the qualified person and the audience. It is only one way communication. Only the lecturer talks and the audience listens. So that's what you call didactic method or one way communication. The second is focus group discussion. In focus group discussion, there is a group of 6 to 12 persons. Among them, one is your leader and one is your note keeper. The job of the leader is to initiate the discussion and manage the discussion among the people of the discussion. And the job of the note keeper is to keep note of the things that are said by the people during the discussion. It is a very effective method of health communication because there are multiple people. They get to talk with one another, with the leader talk to them. So there is two-way communication taking place. There is appropriate time for the audience or the people to express their ideas, views and knowledge. The note keeper has one more job, and that is to form a sociogram. What is a sociogram? Let's say there's a group discussing about antenatal care, and the group contains 1, 2, 3, 4, 5, 6 people. These 6 people, they are arranged in a circular fashion, almost equidistant from one another. Now, when A talks to F, an arrow is drawn in the direction from A to F. When F talks to D, an arrow is drawn in the direction from F to D. And this is the job of the note keeper. Similarly, B talks to D, D talks to E, B talks to F, A talks to B, A talks to C, A talks to E, E talks to F, F talks to E, E talks to F, F talks to E. What does a sociogram show? A sociogram shows the interaction between the patients. By looking at this diagram, you can see which participants are talking more with whom and which participants are talking less. So this helps to find out the level of interaction of individual. And that way, what the leader can do is that, see, since E and F are communicating with one another more, the leader can encourage E and F to share their ideas with the rest of the group. Since C is not communicating that much, leader can persuade and encourage C to open up more and talk with the rest of the members. The advantages of focus group discussion is that it is a two-way communication. People get to appropriately and properly share their ideas, feelings, and knowledge. There is a leader who is there to handle quiet periods when no one is talking. The leader can bring new topics to discuss about. Then everyone is motivated. When one member talks, another person gets motivated to talk, and this in turn influences and motivates another person to talk. There is a note keeper as well who keeps notes of ideas and creates a report of everything that was said. At the end of the session, a summary is also given by the leader. That way everyone is revised about the things that they talked about. Then an interaction is kept uniform using sociogram. So in sociogram, the leader sees who is talking more with who is not talking. That way the leader can encourage everyone to talk uniformly with each other. And then opportunity to learn with one another. This is the most important advantage of all. Individual members of the focus group discussion, they get the opportunity to learn from one another. The disadvantages are that sometimes few members can be overactive or a lot talkative and dominate other members of the group. Or sometimes few members can be less talkative and inactive and don't contribute that much. Sometimes they can talk so much that it is difficult for the leader to handle each of the members. Or sometimes they can deviate from the actual topic. Maybe they are talking about gastritis. From gastritis, they talk about water. From water, they talk about the taps that are present in their home. And from there, they start talking about their grandsons. So, this way, the topic can easily divert from the main agenda of discussion. Okay, after that, there's your panel discussion. In panel discussion, there is a panel of experts. These experts, they talk with one another on a particular topic. However, there is no order of speech. Anyone can talk whenever they have an idea in their mind. And then there's also an audience to listen to them. At the end of panel discussion, there is an Q&A section where the members of the audience get the opportunity to ask questions to the experts and hope for an answer. So in panel discussion, there is 4 to 8 experts, and usually there's a moderator as well to moderate everything. At the end, members of the audience, they get to ask questions. And then there is no specific order of speaking. That is, one needs to speak first, then second, then third, then fourth. No, anyone can speak. Each of them have a mic. He has a mic, he has a mic, he has a mic, he has a mic. He can talk, then he can talk, then he can talk, then again he can talk, maybe again he can talk. Maybe he thinks, okay, now I need to talk, then he talks. So there is no particular order of speech. And then it's two-way because at the end there is Q&A section, so the audience gets the opportunity to talk with the expert, and the expert gets the opportunity to talk with the audience as well. So it's Socratic method. Okay, then there's workshop. In workshop, there is a series of meetings, usually 4 or more. So there's 1 meeting, 2 meeting, 3 meeting, 4 meeting. So each meeting contains a group of people discussing with one another, and then they discuss to learn about some technical skill. Since they need to learn about something technical, trainers or consultants are assigned to them as well. So they can talk with the trainer can talk to them. So it is two-way communication as well, or Socratic method of communication. So what is workshop? Workshop is a series of 4 or more meetings where groups of people, they discuss with one another to learn some technical skills with the help of consultants or trainers that are assigned to them. Then there's symposium. In symposium, you will find a series of lectures. Unlike lecture where there is single lecture and a single lecturer that give lecture on a certain topic and the audience can't talk back to them. In symposium, you have a series of lectures. So you also have a series of lecturers. The first lecturer comes, talks about a certain topic. The second lecturer comes, talks about another topic related to it. The third lecturer comes, talks about another topic related to it. And in the end, the audience get the chance to ask questions as well. In lecture, the audience didn't get the chance to ask questions. In symposium, the audience get the chance to ask questions. For example, class lectures in integrated teaching. One teacher comes, talks about anatomy of digestive system. He goes. Another lecturer comes, talks about physiology of digestive system. He goes. Another lecturer comes, talks about pharmacology of digestive system. He goes. So there is a series of lectures about integrated topics, and students, they also get the opportunity to ask questions. The difference between symposium and panel discussion is that in symposium, there's a series of lecturers, right? These lecturers, they don't talk with one another. They simply talk to the audience. In panel discussion, the panel experts, they talk with one another. In symposium, there is a series to be followed. First, the first lecturer speaks, then the second lecturer speaks, Then the third lecturer speaks. In panel discussion, anyone can talk at any time they want. In symposium, there is a fixed set of speech. That is, the first lecturer has a speech prepared, the second lecturer has a speech prepared. In panel discussion, they come up with idea and then they speak about that idea. They come up with something to talk about and then they talk about it. So that's the difference between symposium and panel discussion. Okay. Then there's conference and seminar. Conference can either be in regional level or state level or national level. And a single topic is taught in depth in case of conference and seminar. So a longer period of time is also taken. Then there's a role play. In a role play, we also call it sociodrama or street play. In street play, so there's a group of people, they perform a play in the community and provide awareness on a health topic, maybe play on mental health, providing awareness on mental health. The thing about role play is that at the end of role play, Q&A section can be taken place with the audience, or the audience feedback can be taken back from the audience. So there is two-way communication. That's why we also call it Socratic method of communication. And the ideal size of audience is less than 25 members. Okay, then there's demonstration. In demonstration, a procedure is shown. For example, you want to teach the people of a certain village where there is lack of pure water how to make ORS solution. For that, you will go with the ORS solution, call the people of the village, and then show them how the ORS solution is made. First, the people, they see how the ORS solution is made, then you make them participate as well. Now the people will come and perform the same thing. So they follow the principle. Demonstration follows the principle. Seeing is believing. What they see, they believe, and learning by doing. So when they do it themselves, they learn it for a longer period of time. So there is two-way communication as well taking place here. Okay, so these were the various types of group approaches for health communication. Now, let's look at mass approach. As I said, in mass approach, a large group of people or a large number of people, it's targeted at once. So that's usually done. That's done with the help of something called mass media. So mass media allows one-way communication. For example, TV, internet, newspaper, printed material, mails, posters, folk media. So these were the various approaches of health communication. But now let's look at the various medias of health education. What are the various medias that can be used to impart knowledge about health? Medias of health education. So you have audio visual aids like audio, video, and then you have IEC materials, which is information education and communication materials, and BCC materials, behavior change communication materials. In IEC materials, you have something called pamphlets, you have something called posters, bulletin boards, and all of that come under IEC materials. But then let's not make things complicated. Let's look at the actual division of medias of health education. So there are four major medias of health education that you need to know. Number one, reading materials. This does not produce any sound, and then you need to read it. So reading materials, you have books, magazines, and newspaper. Audio aids, this makes sound, radio and telephone. Visual aids, you can look at it and understand it. Pamphlet, posters, charts, flannel graph, flashcard, postcard, presentations. Combined audio and visual aids make sound, and then you can look at it. Television, film, drama, folk media. So again, reading materials, audio aids, visual aids, and combined audio visual aids. Okay, let's look at few of the IEC materials that I talked about. IEC materials. You have pamphlet, flashcards, flip charts, and bulletin boards. Pamphlets. So you have one or few pages of printed or handwritten information. So you have 1, 2, 3 or few more pages, and then stuffs are written on it. Then there's a flashcard. Here's the dimension. In flashcard, on one side, a picture is drawn along with the title, and on the other side, information about that particular picture is written. Then you have flip chart, where a number of charts, 6 to 8, are tied together and it can be flipped. Then there's your bulletin board, a board that contains pictures, graphs, charts, cuttings about certain health topic. Okay, let me show you diagrams of each of these IEC materials so that you understand them even better. So what did I say? You had your pamphlet with multiple pages with information written on them, either handwritten or typed. You had flashcard on one side with picture and title, and on the other side with information. You have flip chart, multiple charts tied together and they can be flipped. And bulletin board, a board with pictures, posters, information, and all that good stuff. So those are the various methods of health communication and medias of health education.